Mr. Speaker, sir, the Health Promotion Board introduced the Healthier Choice symbol, or HCS, to help consumers identify healthier food products. Ingredients and food products labeled with the HCS logo, this is the red pyramid, have been well received by consumers. In the 2015 survey by HPB, 70% of Singaporeans recognize the HCS logo and have used it to make healthier food choices. The market share of HCS products have also increased from 15% in 2012 to 18% in 2016. There are currently about 3,500 food products with the HCS logo, spanning 70 food and drinks categories. There are ways to eat healthily without buying expensive food. For example, we can eat in moderation, and we can choose foods with less oil and salt, or drinks with less sugar, or even better, no sugar. NTUC Food Fair sells its pre-packaged drinks with the HCS logo at 10 cents cheaper to encourage more consumers to choose these healthier options. HPB has developed lower-cost, healthier recipes which are shared with the community through partners such as the Diabetic Society of Singapore, Touch Community Services, and NTUC Silver Ace. HPB has also introduced the Healthier Ingredient Development Scheme, or HIDS, and the Healthier Dining Program to support industry players to provide healthier ingredients and products to increase the supply and variety of healthier food options for consumers. Since December 2016, the Healthier Dining Program has been extended to hawker centres and coffee shops where lower-calorie meals are tagged with a lower in calories label. HPB has also implemented various public education initiatives such as the Calorie Literacy Initiative, My Healthy Plate, and the Eat, Drink, Shop Healthy campaign to reward consumers when they choose healthier options. On artificial sweeteners, there is consensus amongst international health authorities and medical professionals that such sweeteners can be used as part of a balanced diet to help a gradual shift away from high-sugar food and beverages. Now, however, the sale of artificially sweetened food and beverages is not allowed in schools in Singapore, as we want to prevent children from developing a habit of consuming sweet-tasting food and drinks from a young age. This complements our Healthy Meals programs in schools, which promotes the drinking of plain water. There's now a growing variety of healthier sugars available for product formulation, such as those derived from natural sources, like beetroot. They do not increase blood sugar levels as much as conventional sugars like sucrose and fructose. The Ministry of Health is working with the food and beverage industry to explore the use of these natural sweeteners as part of their product innovation. We'll continue our efforts to raise public awareness and foster a supportive environment for consumers to make healthier food and beverage choices and to keep Singaporeans healthy and active. Thank you.
Mr. Chong Kee Hiong.
As for your reply, very often we go to departmental stores and we find items that labeled with low sugar content cost more than normal sugar content. So to the general public, they don't understand why low sugar, healthier, I want to choose, but it costs more. And simple thinking is that low sugar means put less sugar, so it should cost at least the same and not much higher. So I've seen items that are, say, for example, normal sugar content, say, cost $3, and the one with low sugar costs $4. So the price difference is quite a lot. So if you want to encourage people to move to healthier diet, so could MOH, educate public why is there such a big difference? Thank you.
Mr. Speaker, I am not familiar with which product Mr. Chong is referring to, but based on the information that we have, there is a range of different healthier products, including house brands, that are offered by supermarkets that need not cost a lot more and sometimes can be very competitive compared to the other brands that are available in the market. So this is one way of helping consumers to be able to have options, including healthier options, to help them to make healthier food and beverage choices. But Mr. Speaker, I want to go back to what I mentioned in my main reply earlier, that eating healthily, there are many different ways of doing so. So for example, it is about choosing the amount you eat, deciding on how much you want to eat, eating in moderation. It is also about how you prepare the food. If you steam it compared to you deep fry it, if you use less oil, less salt, less sugar, less in terms of the sauces, all these are steps which we can then help to prepare healthier food options. We're also working with our research institutes to look at how the food is prepared can also make a difference to the glycemic index. And this is a way of measuring, after you consume the food, how quickly your blood sugar level will rise. And food with lower glycemic index, there will be a smaller increase in your blood sugar level. So what the studies have found is that if you prepare your food, for example, if you cook the rice and then you leave it to cool and you reheat it later, the amount of resistant starch in the rice will go up. And this helps to lower the glycemic index. So for the same type of rice, the same amount of rice, you can actually lower the glycemic index by preparing it in a different way. Other things that they have found include adding, for example, a little bit of chicken stock or a small amount of healthy oil to the rice, and that will also help to lower the glycemic index. How you eat the food also makes a difference. Before you begin your meal, if you consume some protein, so for example, clear chicken stock or a glass of unsweetened soybean milk, before you eat your main meal, these will also help to lower your glycemic index of the meal. Eating it with vegetables, not just the rice alone, with protein. So there are many, many different ways that we can educate consumers, give them more information to help them to make healthier choices. Thank you.
Mr. Chong Kee-Hiong.
I should have been clearer. I was referring to the same brand of Kaya, identical brand. The only difference is with sugar and without, less sweet. And actual price is actually $2.95 versus $3.95 for the lower sugar content. Yeah, thank you.
Mr. Speaker, sir, I thank Mr. Chong for his clarification. I do not know which brand of Kaya he's referring to. I myself, I like Kaya, but because it is quite sweet, I try not to eat too much of it. So I think that's one way of making a healthier choice, which is to consume less of it. When we spread the Kaya on the bread, don't spread it so thickly. That will be one way of helping to lower the amount of sugar that you consume. I'm not familiar with the brand that he's mentioning, but sometimes the reason why certain types of healthier food cost more on a per unit basis is because there's lack of scale. So when you produce it and there's inadequate economies of scale, the merchant finds it difficult to price it at a very competitive level. And we see this happening with healthier cooking oils, with wholemeal bread, that during the initial phase, when the healthier products are being introduced, they have to go through this phase where consumers are getting used to it, and the demand is not quite picking up during the initial phase. So during this period, the lack of scale then leads to prices being higher on a per unit basis. So I do not know if this is the reason for that particular brand of kaya that Mr. Chong spoke about, but this is a general observation that we see for different types of food products. With scale, the merchants are then able to lower their per unit costs, and then this can then be passed through to consumers in terms of lower prices. Thank you.
Given the SMS passion for healthy food, the least we could do is to take heed of his advice at the tea break later.